It is Congenital Heart Defect Awareness Week. 1 in 100 babies are impacted, making it the most common type of birth defect in the world. Experts say early detection is critical to reduce long-term complications.
Dr. Mark Sklansky is a fetal and pediatric cardiologist at Cedars-Sinai. Thank you so much for being here to talk about this.
Thank you for having me.
You know, I think when you hear the numbers, I'm shocked that it's 1 in 100. Are a lot of people surprised by that?
Yeah, it's actually a little bit more than 1 out of 100.
Really?
Yeah.
And can you talk about what it is?
Yeah, a heart defect the heart is a very complex organ, and sometimes in utero it just doesn't form right. The valve may not form, a ventricle may not form, an artery or vein may be abnormal. So we see all forms of abnormalities of how the heart forms when children are born.
And see, I didn't know that there were that many different defects that can happen to the heart. You have brought a heart here today. Do you want to explain a little bit about what you brought here?
Sure. I mean, the other thing that could happen is you just are born with a hole in the heart. That's probably the most common heart defect.
Yeah.
But we'll talk about this a little bit later, I think, when we talk about what women can do to help increase the chance that their heart defect, that the baby's heart defect will be detected early, which is the best way, I think, to have the best outcomes for children.
And on that note, doctor, when should pregnant women get an ultrasound to check?
Right. Yeah. So probably the most important time to pick up a heart defect in utero is at the 20-week ultrasound, about halfway through pregnancy. It's called the anatomic survey, and that's when they look at the whole baby, all parts of the baby, including the heart. And as you mentioned, it's a little more than 1 out of 100 babies is born with a heart defect. It's the most common birth defect by far. But unfortunately, it's actually the most difficult organ system to evaluate before birth.
Oh, okay. So that's what I was going to ask you. Is there anything that can be done while the baby is still in utero?
Yeah, I think in terms of changing the natural history, yes, sometimes we can actually intervene to change how the heart evolves so that a child may be born with less severe form of heart disease. But the most important benefit of early detection is that when we know about a heart defect, we can do the right thing when the baby is born, and the vast majority of children with heart disease can have very long, productive, happy lives, but the key is early detection.
Absolutely. Dr. Sklansky, I want to ask, how big of a role does genetics play in congenital heart defects?
Right, I think it plays a huge, huge role. I mean, now every year we are learning more and more about ways to detect genetic abnormalities that before we were not able to detect. And so a lot of times when we see heart disease, a heart defect, we'll do genetic evaluation, and sometimes we'll find a genetic abnormality. And when we don't find a genetic abnormality, I think there still often probably is an abnormality. We're just not smart enough yet to detect it.
Will AI come into play with some of these things maybe later?
Who knows?
You don't know. Okay.
Who knows?
Can you talk about some of the latest treatments and advancements that have happened?
Yeah, I think probably one of the most important advances is that the technology for looking at the heart has gotten better and better. I've been doing this for several decades, and the ultrasound technology is much better. It's hard to see the baby's heart at 20-week gestation. It's about this size, and there's a lot of tissues intervening. The baby's not always the most cooperative.
Yeah.
So one of the greatest advances is just improved technology to see the baby's heart. There's also advances in ability in a small percentage of cases to actually intervene and put a catheter inside the heart in utero to change the way the heart evolves.
All right.
Great information here.
Well, thank you so much for being with us this morning. We really appreciate it.
My pleasure, and I'm hoping that this will help women identify the importance of this ultrasound halfway through gestation.
Well, I know I learned a lot. I'm sure the audience learned a lot.
I did too, and people like you are helping bring awareness to the issue. So thank you, Dr. Sklansky.
It's my pleasure.
All right.